Massachusetts is home to approximately 3,000 school nurses who bridge healthcare and education. They are often the only medical professional in the educational setting. These highly skilled professionals protect and promote student health, reducing barriers to children attending and being successful in school. The role of school nursing in Massachusetts has evolved over time with ever-increasing responsibilities. The Shattuck Report was the first in-depth study of public health in the U.S. It was the catalyst for smallpox screenings in New York City schools and the very first school nurse. Following New York's lead, Massachusetts began training school nurses to improve the health of children and limit absenteeism. In 1905, Boston hired Annie McKay as the state's first school nurse. In 1906, Massachusetts made student health examinations compulsory to control the spread of infectious diseases. This was part of a broader movement to improve child welfare by identifying and addressing health issues impacting a child's overall development. Continuing to this day, school nurses ensure that students receive required immunizations and are screened for issues such as vision and hearing problems, scoliosis, and substance use. New laws, regulations, and policies around health and education shaped school nursing. They established uniform standards and accountability for health services in schools to ensure that all students received a baseline level of care, regardless of a school's location or funding level. When Medicaid highlighted healthcare gaps for low-income populations, Massachusetts became home to one of the nation's first school-based health centers in 1967. Expanding access for students. As of 2025, Massachusetts has 65 school-based health centers. State laws advanced school nursing further, setting new standards, for example, the Bachelor of Science in Nursing license requirement and mandated training for administering EpiPens and other medications. Dedicated funding for school health marked a shift in comprehensive school health programs. Investments from the Prevention and Wellness Trust Fund in 2012 increased school-based training and prevention strategies, resulting in improved health outcomes for children with asthma. With increased attention on student health and well-being, school nursing became more professionalized and visible. This was due in part to the advocacy efforts of the Massachusetts School Nurse Organization, which focused on standards, professional development, and advocacy. The Massachusetts Department of Public Health established the School Health Services Program, providing clinically trained professionals to schools and school nurses. The new Essential School Health Services grant program increased the number of school nurses and established a statewide network to effectively manage student health in schools. In 1995, School Health Services, in partnership with the Department of Elementary and Secondary Education, published the Comprehensive School Health Manual, creating the first-of-its-kind guide for all things related to health and clinical care in Massachusetts schools. Today, school nurses play a critical role in supporting students with complex healthcare needs and the overall move towards inclusion in the school community. The COVID-19 pandemic created an unprecedented and prolonged crisis to schools and communities. Amid fear and anxiety, school nurses demonstrated courageous leadership at the forefront by providing vital public health guidance. The school nurse profession continues to change, with an increased focus on health equity and the growing social and emotional challenges that students face. All this means increased responsibility in a complex world for the school nurses serving over 900,000 students in the Commonwealth. For more than 100 years, school nurses have been trusted leaders in school health. Today, that legacy continues, ensuring students are healthy, safe, and in school, ready to learn.